engagement, work and implementation on the elimination of violence against women, and more than that, the elimination of gender-based violence. So we have started a series of discussion on the November 25th, and we will end as usual, in December the 10th with the Human Rights Day, as an important day where, our 60 days of activism and our series of discussion will end. But as we are always framing it, it's not only about 16 days for us and for UNFPA, it's 365 days that we are working to end violence against women, trying to improve our programming, trying to support, to protect, to respond, provide care, provide cash assistance, a different type of strategy that will be really support this really important cause. So I would like to introduce the title of today's conversation. It's about Empower to Choose, leveraging cash assistance in gender-based violence responses. So this event is so important because it reflects also our strong partnership here with the humanitarian office. And so it's today Humanitarian Response Division that has been working intensively in this issue of cash assistance in gender-based violence in the humanitarian context. But what we are going to also learn, and some of the lessons that we want to bring into our response on gender-based violence in development context. So the use of cash and voucher assistance for protection outcomes, including the integration of cash and voucher assistance to gender-based violence, has been gaining increased focus. In today's event, of course, we will outlining how cash assistance within a gender-based violence response programming can contribute to positive outcomes of reduced gender-based violence risk and life-saving support, offering choice and agency alongside critical services. Please note that the event is being simultaneously translated in English, Arabic, French, and Spanish. And you can see a button on the bottom of your screen, interpretation. So click on it and choose a language that you are comfortable with. So UNFPA is really, pleased to host this event, which is co-sponsored with the Swiss Agency for Development and Cooperation and the United States Bureau of Population, Refugee and Migration. Without further ado, allow me to introduce our estimated speakers to open the event. So we are going to listen to Madame Jenny Keita, UNFPA Executive Director for Programs and Assistant Secretary General. Then we will hear from Ms. Nicole Röder, Head of Multilateral Affairs at the Swiss Agency for Development and Cooperation. And then Julita Weiss-Noyes, Assistant Secretary of the United States Bureau of Population, Refugee and Migration. So thank you so much for joining us today. And I would like to invite our dear UNFPA Deputy Executive Director, Jenny Keita, to deliver her opening remarks. And thank you again for joining us, Jenny.
Thank you so much, dear Nafi. Dear colleagues, esteemed guests, Madame Röder, Head of Multilateral Affairs of the Swiss Agency for Development Cooperation, Madame Weiss-Noyes, Assistant Secretary of the United States Bureau of Population, Refugees and Migration, Madame Wine, Deputy Assistant Secretary of the United States Bureau of Population, Refugees and Migration, distinguished guests, colleagues and partners, good morning, good afternoon, good day, wherever you are. I am pleased to join you today and to welcome you to this important event, Empowered to Choose, leveraging cash assistance in gender-based violence response, which is part of, just like Nafi said, UNFPA series of events to mark the 16 days of activism. I would like to thank the Swiss Agency for Development and Cooperation and the US Department of State's Bureau of Population, Refugees, and Migration for co-sponsoring this event with UNFPA. Gender-based violence continues to represent significant challenges in the world. It is still one of the most prevalent human rights violations. It knows no social, economic, or national boundaries. Estimates show that approximately 1 in 3 women worldwide have been subjected to either physical or sexual intimate partner violence and non-partner sexual violence in their lifetime. As many as 1 in 4 women experience physical and/or sexual violence during pregnancy. And while roughly 5,000 honor killings are reported every year around the world, experts estimate that the actual numbers are much higher. That is why ending gender-based violence and harmful practices is one of the UNFPA 3 transformative results under our current strategic plan. These numbers will get worse if we are not able to take action. Before COVID-19, the global cost of ending violence against women was estimated to be approximately 1.5 trillion US dollar. And more recently, analysis has indicated that the cost of ending gender-based violence will require investing 42 billion in 132 priority countries over the next decade. I point these statistics out because the numbers are crucial. In fact, numbers and finance are at the center of our conversation today, given the impact that cash assistance can have in facilitating gender-based violence prevention and response. We know that women and girls affected by complex crises often face increased risk of gender-based violence, be it within their own households or at the hands of external perpetrators such as landlords, employers, human traffickers, or armed actors. Therefore, integrating cash within gender-based violence case management is a personalized approach to helping women and girls in need. Evidence has shown that cash assistance is dignifying, discreet, and flexible. Ladies and gentlemen, I would like to acknowledge the financial support of Denmark, Switzerland, and the United States, which has enabled UNFPA to increase the use of cash and voucher assistance to work towards fulfilling our commitment to the grand bargain, the call to action to end gender-based violence, as well as our strategic plan. The Swiss Agency for Development and Cooperation has been a key strategic contributor to strengthening UNFPA's use of cash and voucher assistance, deploying 2 Swiss secondmen to UNFPA's Humanitarian Response Division since 2021, who focus on cash assistance and its linkages with gender-based violence and sexual and reproductive health. I would like also to acknowledge the role that SDC has as a pioneer and champion for cash assistance, both as an operational agency and as a donor. Over the last 2 years, UNFPA has been integrating cash assistance into gender-based violence case management, and we are building on our work to take stock, document successes, identify challenges, and learn how the impact can be scaled up effectively. Much of this relies on speaking with women and girls to understand how cash assistance and GBV response has worked for them. Why? What they tell us is that cash and voucher assistance has contributed to improve access to GBV, prevention, and response to services like life-saving transportation and accommodation, and it has supported access to health services, and it has reduced household tensions. Most importantly, it has provided vulnerable women and girls with more choices in the face of life-threatening circumstances and risks. We are already seeing good results in 14 countries where cash assistance is being utilized. The voices of UNFPA country offices and local partners are critical here, and we are excited for the chance to showcase them during this event. For now, I am pleased to hand over to Madame Ruder, dear Nicole, Head of Multilateral Affairs at the Swiss Agency for Development Cooperation. With that, I am pleased to give the floor to Nicole. Nicole, over to you. I thank you all.
Thank you. Thank you so much, DED. So we'll see a video from Ms. Ruder.
Thank you very much, UNFPA, for the warm introduction and for inviting us to take part in this year's Unite campaign. It is high time and highly relevant to focus on the incredible work and the voices of GBV caseworkers. Before I go on, my name is Nicole Ruder and I am the Head of Multilateral Affairs at the Swiss Agency for Development and Cooperation. Back to our topic. When we listen to the voices of caseworkers of gender-based violence, we hear again and again, and not entirely surprisingly, that cash is key when it comes to providing assistance to GBV survivors. This is money towards a train ticket to get to safety, money to move out of an abusive home, money for emergency health care, you name it. GBV case managers are often so passionate about supporting survivors of GBV that they end up paying out of their own pockets when urgent needs cannot be met otherwise. This is commendable and it is compassionate, but we have to do better. With dedicated cash and voucher programs, GBV professionals will be able to do this more systematically and, most importantly, far more effectively. Switzerland has started using cash assistance in the late 1990s. Ever since, we've been a strong supporter of the modality as a donor, as an operational agency, and as an advocate. It is not hard to understand why, in most situations, cash is the right approach. It makes economic sense, it allows for individual solutions, but most importantly, it respects people's agency and people's dignity. We know the cash modality mostly from humanitarian situations. It is equally appropriate and equally life-saving for survivors of GBV everywhere. We're very happy to see how much knowledge and understanding UNFPA has accumulated over the last years. UNFPA has done three very commendable things. Firstly, UNFPA has really pushed the advocacy for the use of cash in GBV response. Case in point, we are all here today. Secondly, UNFPA has established global guidance and reality-based best practices. The humanitarian cash approach cannot be transposed one-to-one to GBV response. There are questions of confidentiality, questions of decentralized follow-up, so it needs to be tailor-made. Thirdly, UNFPA has empowered local GBV caseworkers and organizations to use a cash approach. As a strong supporter of the localization agenda, we think UNFPA is on the right track, but a lot more must be done to strengthen local organizations, especially local women-led organizations. For all the reasons I just listed, Switzerland is happy to support UNFPA with expertise, as a sounding board and as a key donor. But every cause needs a movement. We invite other donors, organizations, advocates to join us in sharing learnings and best practices, but also in working towards including cash in the budgets of GBV response programs. This is not just about a technical modality. It gives real women, real girls, in fact anyone affected by GBV, the power to make their own decisions about their protection and their physical and their mental health. Thank you very much.
Thank you. And we will have the second video from Ms. Noyes from the Bureau of Population, Refugee and Migration.
Hello, I'm Julieta Valls-Noyes, the Assistant Secretary of State for Population, Refugees, and Migration, and I'm pleased to share a message with you for this important discussion. I want to start by thanking UNFPA for its strong leadership on preventing and responding to gender-based violence in emergency situations. The United States is proud to co-sponsor this event and to partner with UNFPA on preventing and responding to gender-based violence. We are committed to the protection and empowerment of women and girls. These efforts are life-saving priorities and should be an integral part of every humanitarian response. Through the U.S. government's Safe from the Start initiative, we have been supporting UNFPA's innovative efforts to integrate cash and voucher assistance within case management services for survivors of gender-based violence. Cash assistance is a dignified, discreet, and flexible way to help survivors escape violence and violent relationships, seek emergency services, and secure temporary shelter. Such assistance helps women and girls make their own choices about their health and their safety. These efforts are an excellent manifestation of Safe from the Start's objective to support innovation and best practices for life-saving services in humanitarian settings. We recently launched an expansion to our flagship initiative called Safe from the Start Revisioned. The goal of Safe from the Start Revisioned is to protect all individuals, and particularly women and girls, from all forms and threats of gender-based violence in emergencies. The initiative calls on everyone in the humanitarian community to take collective action to prioritize gender-based violence prevention and response from the onset of every humanitarian response. We want Safe from the Start Revision to lead to bold steps forward. To this end, and building on lessons learned, the United States commits to strengthening promotion of women's leadership, prioritizing support for gender-based violence prevention and response, and shifting funding and decision-making power to women and girls. Through this new iteration of the initiative, we are shifting power to crisis-affected women and girls by elevating their expertise, welcoming their contributions to survivor-led service provision, and embracing their leadership. Protecting and empowering women and girls in emergencies requires our concerted collective action. We are proud to collaborate with UNFPA on this effort. I am delighted that today's discussion will illustrate the power of collaboration and the importance of making this initiative a reality. Thank you.
Thank you so much. Thank you so much, Ms. Rudder and Ms. Noyes, and again, Ms. Keita, for setting the stage and opening this event. We really value your time to join us today, and we are so confident that with your support and your leadership, we'll be able to do more and to save the life of women and girls. I would like just to say that in the past 2 years, particularly the number of UNFPA country offices using the cash in GBV case management approach has increased. This has been made possible, of course, through strategic partnership, such as with the government ministries of those countries. So today we have Ms. Afaf Khalid Taleb, National Protection Coordinator, Lebanon Crisis Response Plan, Lebanon Ministry of Social Affairs. I'm really pleased to pass the floor to Ms. Taleb. Over to you. Thank you.
Thank you so much. Just checking that you can hear me well.
Very well, very well. And we can see you. You're beautiful, Afaf.
Oh, thank you so much. Thank you so much. Likewise. Good morning, good afternoon, Your Excellency, distinguished guests, ladies and gentlemen, and colleagues from all over the world. Good morning and good afternoon, I think. I would like first to start by thanking UNFPA for the invite. It is with a great honor and pleasure that I join you today at this global event. empowered to choose, leveraging cash assistance and GBV response, to speak about our joint responsibility as government, UN agencies, and non-governmental organizations to end violence against women and girls. I would like also to seize this opportunity to underline the strong efforts of the GBV sector in Lebanon to eliminate violence against women and the strong technical support that UNFPA continues to provide the sector with, being a leading global agency working towards the prevention and response to gender-based violence. For around 3 years now, Lebanon has been assailed by multiple crises, including a financial and economic collapse, a global pandemic, a devastating explosion at the heart of its capital, Beirut, political uncertainty, cholera outbreak, and the detrimental burdens of the displacement and refugee crisis. As the country continues to host the highest number of displaced refugees per capita in the world, with nearly 1.5 million Syrian displaced and around 180,000 PRL Palestinian refugees from Lebanon and 30,000 Palestinian refugees from Syria. These compounded crises have worsened the socioeconomic situation of the different population groups in the country, and it has heightened the vulnerabilities of women and girls by exposing them to additional GBV risks. Under the leadership of the Ministry of Social Affairs, which I'm proudly presenting today, the Lebanon Crisis Response Plan continues to be the main framework to respond to the emerging needs of the Syrian displaced, vulnerable Lebanese, Palestinian refugees from Lebanon, and Palestinian refugees from Syria in a holistic and a comprehensive manner. And with the protection of vulnerable populations being the first strategic objective of the LCRP, the protection sector, including the GBV and child protection sectors, continues to work rigorously to ensure that the most vulnerable groups have their rights respected, live in safety and dignity, and are protected against all risks of violence, abuse, and exploitation, including all forms of gender-based violence. We are extremely grateful to all the efforts of UNFPA Lebanon office to support the coordination of the GBV sector in Lebanon, alongside the Ministry of Social Affairs, and to technically guide the sector to integrate cash assistance into GBV response and to scale up its cash programming in a safe and dignified manner. To this end, the GBV sector, together with the protection and CP sectors, have worked thoroughly during 2022 to develop a unified cash guidance on how to safely provide cash assistance linked to protection services, including GBV case management. UNFPA experience has been instrumental in this step to highlight the positive impact of the integration of cash assistance within GBV case management, on mitigating further GBV risks, and on supporting GBV survivors and individuals at risk through a comprehensive package of GBV services. UNFPA contribution to the development of the guidance was also essential to ensure that all cash assistance delivered in the context of GBV case management is aligned with a survivor-centered approach and with the GBV guiding principles of safety, confidentiality, dignity, self-determination, and non-discrimination. Through their cash project, UNFPA were also able to support GBV case management partners by accepting referrals to ensure that cash assistance is integrated into the case management process and delivered alongside parallel services. That said, we look forward as a ministry with the continued coordination and collaboration with UNFPA under the Lebanon Crisis Response Plan, and to the continued and generous support of UNFPA to Lebanon's government and to all the GBV actors in the country. Together we are stronger. We are able to bring an end to all forms of violence against women, girls, men, and boys in Lebanon and in any other place in the world. Thank you so much.
Thank you so much, Afaf. Oh my God, this is so great. Thank you for your input. Thank you for your great partnership in Lebanon with UNFPA. And we really appreciate your thought, your time, your energy in making this happening. So the experience of Lebanon integrating cash assistance into gender-based violence response and scaling up cash programming in a safe and dignified manner is a testament to the great partnership that we do have in that particular area with also our donors who are supporting so generously the work that UNFPA is doing. So I'd now like to turn over to Ms. Joanna Friedman. Johanna is a cash and voucher assistant specialist in the UNFPA Humanitarian Response Division. And she's going to guide the following conversation with experts, gender-based violence practitioners, and researchers. We will also hear the voices of survivors and examine the evidence of cash assistance contribution to positive GBV outcomes. So over to you, Joanna, and it's a pleasure to see you this morning for me and probably afternoon for you in Geneva.
Thank you so much, Madame Nafi. Thank you. And thank you very much to Ms. Taleb from the Lebanon Ministry for reminding us about the importance of working together with governments and with local partners to integrate cash into protection and GBV programming, and particularly into GBV case management. Case management is truly one of UNFPA's flagship GBV programs, a process through which women and girls who report gender-based violence can work one-on-one with a case manager to make a plan to access timely and quality services and make informed decisions about their lives and safety. And so today I'd like to start by turning to one of our GBV specialists, our GBV advisor, Alex Robinson, based in our headquarters, and ask a question at a global level. So Alex, given your global viewpoint and your previous field experience working with UNFPA country offices, do you see this approach of cash within GBV case management as filling a gap in current practice? And what do you think that our local partners can gain from applying this innovation? How can we support them with this innovation? Thank you, and over to you, Alex.
Thanks so much for the questions, Joanna. It's a real pleasure to be here, and thank you to all the people who've spoken before me. I think you've covered so much of the reason why we engage in cash and voucher assistance through our GBV programming. I would say so much of what we do, or everything that we do, is guided by the principle of survivor-centered approaches to our work. And in order for us to be able to action that, in order for us to be able to be survivor-centered, I think it's absolutely critical that we consider cash as fundamental to ensuring that survivors can in fact access all of the services that they need while feeling, while being, having the dignity and the empowerment to be able to do that. So in essence, yes, I think it's been a gap, and I think the way that UNFPA and our partners are now doing this together is working towards closing that gap and being able to make survivors' action plans actionable. I think what we have also seen increasingly is case managers or local organizations actually coming out of pocket to be able to pay for some of these expenses, things like clothing in the first instance, or transportation to be able to access the range of services that might be available. Cash has shown to be dignifying. It's discreet, it's flexible. It also helps survivors to escape violence and violent relationships, in addition to being able to access all the services they need. So I think in our mind, using cash as a mechanism to be able to support survivors brings us closer to being able to achieve our transformative result of zero gender-based violence.
Thanks so much, Alex. And looking back at what our colleague, Ms. Nicole Reuter from SDC said about this approach applying across all settings, do you believe that this approach can be used across humanitarian and development contexts and everything in between?
Yeah, absolutely. I think so much of what what is happening in the humanitarian space in terms of cash programming and has over a really long time is we're starting to understand how that work is now contributing to broader social protection systems in different countries. And certainly, how we start to connect what we do in GBV case management with much broader social safety nets. And certainly, this has been very much part of the work in Lebanon and Jordan. So how do we move beyond cash as an emergency response and as a preparedness process? And part of that obviously is then embedding that into systematic case management. I would also add that none of this is possible without working across all of our local partners and women's-led organisations who are such a critical component of everything we do in supporting survivors of gender-based violence. Thanks, Joanna.
Thank you so much, Alex. And with that, we will turn now to the voices from the field who will describe in very real detail today the kinds of cases that we see that can benefit from cash within GBV case management, that will tell us about the process of this approach and the impact that it can have on women's lives. So we will first hear from a recording from Miles Paredes, a caseworker with the Coalition Against Trafficking in Women, Asia Pacific, which is one of UNFPA's partners in the Philippines. Please listen in.
Ako po ay isang caseworker ng CATWAP at may grupo ako na Empowered Women Survivors Collective na ang focus ay tumulong sa mga rape victim, sexual trafficking at mga violence against women. Sa amin kasi madami na kaming natulungan na mga victim, lalo na yung sexual trafficking noong time ng pandemic, sobrang dami kasi unang-una, nawawalan ng trabaho. Wala silang trabaho, so wala silang ibang pagpipilian, kundi parang vulnerable sila na sumama na lang doon sa mga bugaw or yung mga lumalapit sa amin. Talagang mahihirap itong mga kababaihan na ito at mga biktima ng incest rape at ng iba't ibang uri ng karahasan doon sa, kasi nauso yung online. So, kapag meron silang mga ka-chat o mga pumapayag sila na makipagkita kahit sobrang delikado. At pangalawa, yung violence din sa mga nanay, sa mga kasi magkakasama yung pamilya, so mas vulnerable yung mga nanay na mga sinasaktan ng mga partner nila dahil laging sinasabi mainit ang ulo kasi walang trabaho. At yung mga nanay din kadalasan ang lumalabas para magtrabaho. Tumawid sila ng border para sana magtrabaho. Hiningan sila ng sexual na favor ng mga pulis. So hindi lang isang pulis ito. Hindi lang isang babae din ang naabuso sa border. Meron din naabuso sila, tapos binabalikan sila sa bahay, pinupuntahan sila. Marami din kabataan na nung time ng pandemic na na-rescue ng CATWAP at ng grupo namin na ganun pa rin sa sex trafficking pa rin sila na pumunta, ito ay mga 17 years old. At meron din po kaming 9 na kabataan na galing sa Odette. Akala nila magsiserve sila as yung sa online sabong, pero sila yung minomodel ng yung sa online sabong, imbis na yung mga manok, sila yung hubad na pinapakita at doon sila pinagpipilian ng mga kalalakihan na bumibili. Yung ibang mga women, pumapayag sila kahit halagang magkano para lang kapalit ay bigas o kahit anong bagay para lang makakain ng pamilya. May mga nanay din na pumapayag na isama ang kanilang mga anak, lalo na nung pandemic, kahit hindi nila alam kung ano yung mangyayari sa anak nila, kasi iniisip nila yung pang-araw-araw. So yung kababaihan para sa amin talaga, sila yung nung pagpanahon ng disaster, sila yung mas nag-iisip ng paraan paano mabuhay yung pamilya. Kaya kahit sarili nila nalalagay sa delikado, sa alanganin, hindi nila yung iniintindi kasi gusto nilang kumita ng pera para sa pamilya nila. Marami po ang nagamit yung pera sa livelihood. So, kumbaga, nag-start sila sa maliit na yung pera na yun at napapalago ng iba yung So, ngayon, yung mga nag-business ay tumutulong na rin sa mga hindi nabigyan. Nagkaroon din ng yung programa ng yung online support. Maganda yung programa na yun kasi sobrang daming kababaihan na contact na nakausap namin at nabigyan din ng support, hindi lang sa financial, kundi yung sa medical kasi sobrang daming nagkaroon ng sakit din. Tapos yung healing conversation, nagkaroon din kami ng mga legal na kasi mga nagkakaso, katulad nga po nung sinabi ko na 9 na kabataan na galing sa disaster area din yun na mini-model na parang mga manok sila. Sa ngayon naman ay okay na sila kasi at malaking tulong nga yung financial assistance na kasi parang natugunan yung pangangailangan nila na kaya naman sila na ganun, pumayag sa ganung sitwasyon kasi kailangan nga nila ng pera.
So we heard from Miles about all the different challenges and the really heartbreaking challenges that women and girls face and have faced in even greater severity since the COVID-19 pandemic. And I think a common theme you'll hear today is how economic hardship can exacerbate gender-based violence, both in the household and, as Miles described, online and in the community. So cash can help to smooth over some of that economic hardship and can be truly life-saving. As we will see now from our speaker from Colombia, Andrea Pacheco. Andrea is GBV Case Management Supervisor with UNFPA Colombia. Good morning, Andrea, and welcome. Andrea, in your context of Colombia, a country affected by internal conflict and displacement, which also hosts refugees from Venezuela, as well as returnees, from what you've seen and learned so far, from your approach of having cash as an option for GBV survivors within case management when appropriate, what is the impact that cash assistance can make for these survivors?
Hola, Johanna, muchas gracias a ti y a todos quienes nos acompañan en este espacio. Quisiera compartirles que desde UNFPA Colombia, las mujeres sobrevivientes de violencia basada en género que acuden a nuestros servicios de gestión de casos se enfrentan a diferentes realidades o tienen doble afectación, tanto por ser víctimas del conflicto armado interno como por la migración irregular de Venezuela hacia Colombia. La implementación de nuestros programas se ha centrado principalmente en las periferias del país. La primera es la costa pacífica, específicamente en el Chocó y Nariño. Y la segunda en la frontera con Venezuela en 3 departamentos, Arauca, norte de Santander y La Guajira, los cuales tienen presencia de actores armados ilegales y sus pasos fronterizos irregulares suelen ser administrados por grupos delincuenciales binacionales. En los servicios de gestión de casos que hemos atendido, este año van más de 1000 casos. Hemos integrado las transferencias monetarias, multipropósitos e incondicionales como un mecanismo que adiciona valor y contribuye a la respuesta efectiva a las sobrevivientes de BBG. Se ha utilizado de diferentes formas. Una de ellas, por ejemplo, ha sido para protección. El efectivo se ha integrado para complementar esas acciones dentro de la gestión de casos de quienes están en alto riesgo porque sobrevienen situaciones como retornos seguros luego de un incidente de BBG, situaciones de trata y explotación sexual, cuando se presentan nuevos ataques que podrían ser inminentes o han vivido afectaciones que han puesto en riesgo su vida, las cuales requieren de un apoyo inmediato para garantizar el acceso a servicios o la protección de ella y generalmente de sus hijos, hijas y dependientes más cercanos. También ha apoyado las decisiones de las mujeres para salvaguardar su vida e integridad personal, retornos y reunificaciones seguras para protegerse de la violencia. Hemos tenido muchos casos exitosos, por ejemplo, una mujer sobreviviente migrante que vivió una tentativa de feminicidio y por medio del efectivo y la articulación institucional se reubicó en otra ciudad y allí pudo iniciar con la venta de manualidades tejidas y hoy no solo salvó su vida y la de sus 2 hijos, sino que tiene un plan de vida para ellos. O algunos otros asociados a sobrevivientes que llegaron de Venezuela con la esperanza de amistades que les vendían la idea de un trabajo y estabilidad y al llegar eran retenidas para trabajo sexual. Se han apoyado casos de esta magnitud en las que se ha podido pagar deudas por su libertad y poder retornar a un lugar seguro y hacer reunificación segura con sus familias, o buenas prácticas como el uso efectivo para iniciativas de negocio, que permiten esa independencia y empoderamiento económico, la toma de decisiones que afianzan ese empoderamiento, rompiendo ciclos de violencia alrededor del cuidado no remunerado y la satisfacción de necesidades básicas para ellas y sus familias. Otro aprendizaje es que efectivamente es útil como una forma de mitigar riesgos de BBG, de prevenir la aceptación de relaciones abusivas, el sexo por supervivencia y otras expresiones de BBG asociados a la vulnerabilidad que sobreviven muchas mujeres en contextos de crisis humanitarias. Se identificó que las mujeres se encuentran en riesgo, usaban parte de esos recursos para comprar elementos que aportaran a sus medios de vida. Y es por esto que con el acompañamiento de las gestoras de casos se ha logrado orientar la gestión del caso para llevar a que las mujeres, dentro de su plan de acción, pudieran proveer apoyo para lograr que el pequeño emprendimiento pueda contribuir a la obtención de recursos de una forma mucho más permanente. Se continuó también con la vinculación de servicios multisectorial, en especial aquellos relacionados con el fortalecimiento de los medios de vida, siendo esta una de las medidas efectivas para la mitigación de estos riesgos. Asimismo, el proceso de entrega, la forma de acceder a la asistencia en efectivo por medio de un acompañamiento psicosocial y una gestión de casos, contribuye en la recuperación de las mujeres sobrevivientes, porque la decisión sobre el uso del dinero se ha orientado a cubrir necesidades que la mujer considera relevantes y facilita la toma de decisiones frente a su vida. Aquí incluso algunas han logrado y han puesto en marcha estrategias de generación de ingresos, microemprendimientos que facilitan soluciones a mediano plazo, reduciendo esa dependencia económica de sus agresores. Todo esto se ha logrado con el acompañamiento de las gestoras de casos, quienes motivan, empoderan y dan ese soporte a que los planes que la sobreviviente se ha trazado en la gestión del caso y la atención psicosocial desde el enfoque centrado en la persona sobreviviente sean alcanzados. Para hacer sostenibles estas medidas, hemos adelantado también la entrega de cash recurrente, que ha tenido mayores impactos en la mitigación de daños, en especial para que las sobrevivientes pudieran identificar estrategias y medidas que aportaran a sus medios de vida. Así, desde la supervisión que realizo a las gestoras de casos en el uso del efectivo, orientamos esa distribución de los recursos para la satisfacción de las necesidades básicas y la priorización de sus necesidades. Asimismo, estuvo destinado a facilitar el acceso a servicios de salud sexual y reproductiva, así como otros bienes y servicios relacionados que no estuvieran cubiertos por el sistema de salud y que pudieran afectar el ejercicio de los derechos sexuales y reproductivos en la vida de las mujeres, adolescentes, mujeres gestantes, entre otras quienes viven en contexto de necesidades humanitarias como la migración. Muchas gracias.
Thank you so much, Andrea. And I think you've really driven home the point about the very individual needs that women have when they're affected by violence, and how cash is really this kind of unique tool that can respond to each person's individual needs, at least in the short term. We know that it can't be a holistic solution on its own, but it can be truly life-saving in the moment in which it's given. So I would like to now pose a question to Rayan Kashkash from the Lebanese Council to Resist Violence Against Women, one of UNFPA's partners in Lebanon. And Rayan, can you please tell us about the 3 types of cash assistance that you provide within case management based on different needs, and how this is making a difference for women in Lebanon? Thank you.
مرحبا بالجميع. أنا ريان قشقش، مسؤولة العنف القائم على النوع الاجتماعي في الهيئة اللبنانية لمناهضة العنف ضد المرأة. في البداية أود أن أشكر الفريق المنظم على اختياري لأكون جزءا من هذا الحدث الرائع، وإنه لشرف عظيم علي أن أمثل منظمتنا في تسليط الضوء على تجربتنا في دمج النقد في أنشطة الاستجابة للعنف القائم على النوع الاجتماعي. منذ ما يقارب عامين بدأت الهيئة اللبنانية لمناهضة العنف ضد المرأة وبالشراكة مع صندوق الأمم المتحدة للسكان بتقديم مساعدات نقدية للناجيات من العنف المبني على النوع الاجتماعي. تعتبر المساعدة جزءا من خدمات الدعم النفسي والاجتماعي المتكاملة التي يتم تقديمها ضمن عمليات إدارة حالات العنف القائم على النوع الاجتماعي في المساحات الآمنة التابعة للمنظمة، وهي مرتبطة بإدارة الحالة وتعتبر أداة تكميلية في خطة عمل الناجيات. وهذا يعني أن النقد لا يعتبر تدخلاً قائماً بحد ذاته، ولكنه خدمة إضافية ممكنة ومتاحة للناجيات في سبيل الوصول إلى الأهداف المحددة في خطة العمل. يتم تقديم المساعدة النقدية بعد إجراء تقييم عملية إدارة الحالة العنف القائم على النوع الاجتماعي ومناقشة مدى ملائمة المساعدة النقدية للحالة المحددة. تقدم منظمتنا 3 أنواع من المساعدات النقدية، وهي النقد مقابل النقل، المساعدة النقدية الطارئة، والمساعدة النقدية المتكررة. يتم تقديم النقد مقابل النقل للناجيات ليتمكنوا من تلقي خدمات إدارة حالات العنف القائم على النوع الاجتماعي في مراكز المنظمة، والتي بخلاف ذلك يمكن أن تتوقف في فعل المصاعب الاقتصادية. ومما ساهم في تفعيل هذه المساعدة على وجه التحديد هي الزيادة الكبيرة في تكاليف المواصلات في أعقاب التضخم الاقتصادي الهائل في لبنان. أكدت العديد من الناجيات أنهن لن يتمكن من الحضور لتلقي خدمات إدارة الحالة بسبب عائق النفقات المواصلات، وقد يجدن أنفسهن مضطرات للتوقف، وعلى الرغم من أنهن في أمس الحاجة إلى الخدمات المقدمة في المركز. لمعالجة هذا الأمر قدمت منظمتنا وبدعم من صندوق الأمم المتحدة للسكان هذه المساعدة النقدية لضمان الوصول إلى خدمات العنف القائم على النوع الاجتماعي، وليس جعل الخدمات متاحة فحسب، من خلال تغطية جزء من نفقات النقل. على سبيل المثال شاركتنا إحدى الناجيات: لقد كنت متحمسة جدا لحضور جلسات الدعم النفسي والاجتماعي في المركز وتلقي المشورة المناسبة، ولكن نظرا لأنني لم أكن أعمل كانت تكاليف المواصلات عبئا علي للوصول إلى المركز. من خلال المبلغ الذي تلقيته مقابل كل زيارة لمتابعة الجلسات تمكنت من دفع أجرة التاكسي والتنقل بأمان والاستفادة من الأنشطة المختلفة المقدمة من المنظمة. بالإضافة إلى ذلك هناك المساعدة النقدية الطارئة، وهي دفعة لمرة واحدة فقط، تقدم لتغطية الاحتياجات الطارئة للناجية التي تعرضت للعنف أو لمعالجة موقف في عرض الفرد لخطر العنف القائم على النوع الاجتماعي. ومن الأمثلة على ذلك مرأة تعرضت للضرب المبرح وتعاني من كدمات وكسور. للاستفادة من المساعدة النقدية الطارئة للوصول إلى الخدمات المتخصصة ذات التكلفة، والتي تشمل على صعيد المثال الأشعة السينية والجراحة الصغيرة أو الأدوية. بالإضافة إلى ذلك واجهنا العديد من الحالات التي عانت فيها النساء من العنف الجسدي وتم طردهن من منازلهن. تلقت هؤلاء الناجيات المساعدة النقدية الطارئة لتأمين الحماية الفورية والانتقال إلى مسكن آمن مع أطفالهن بعيداً عن الوضع المسيء. كل هذا يتم بالتنسيق والمتابعة مع مسؤولات الحالة، وبما يتماشى مع خطة العمل الموضوعة من أجل ضمان الحماية والسلامة للناجيات من العنف القائم على النوع الاجتماعي. تهدف المساعدة النقدية المتقررة إلى التخفيف والحد من مخاطر العنف القائم على النوع الاجتماعي على المدى الطويل، مما يقارب حتى 6 أشهر تقريباً. بالإضافة إلى ذلك تهدف إلى مساعدة إلى تحسين الصحة البدنية والعقلية للناجيات. على سبيل المثال قمنا بدعم إحدى الناجيات من العنف التي أرادت الفرار من منزلها. لحسن الحظ كان لديها مكان آخر للعيش فيه، ولكنها كانت بحاجة إلى الدعم لتغطية احتياجاتها الأساسية وتجنب آليات التأقلم السلبية. من خلال المساعدة النقدية التي تلقتها اكتسبت الشجاعة للخروج واستعادة الشعور بالأمان والتمكين. كان هذا يعتبر حلاً أكثر استدامة للبقاء في مأمن من المعتدي والقدرة على التعافي. قالت إحدى الناجيات: كنت تحت ضغط هائل ولم أتمكن من اتخاذ القرارات. أنقذت المساعدة النقدية حياتي، حيث تمكنت من ترك زوجي المسيء وتأمين مأوى لنفسي ولأولادي. تتيح المساعدة النقدية تقديم خيارات ممكنة في إدارة حالات العنف القائم على النوع الاجتماعي لم يكن بالإمكان تقديمها من قبل بسبب نقص الموارد المالية. فهناك حوالي 95% من اللواتي حصلنا على المساعدة أنهن قد تمتعن بوصول أفضل إلى الاحتياجات والخدمات الضرورية المتعلقة بالعنف المبني على النوع الاجتماعي. وأكدت 90% من اللواتي حصلن على المساعدة أن المساعدة النقدية قد خففت على مستويات مختلفة من المخاطر المباشرة التي تنبعث من العنف المبني على النوع الاجتماعي. وذكرت 93% أن النقد ساهم في تقليل مستويات التوتر حول تلبية الاحتياجات المحددة. باختصار أظهر النقد أنه مكمل فعال للخدمات الأخرى المتاحة من خلال إدارة الحالات، وأدى أيضاً إلى تأثير إيجابي في التخفيف من تبعات العنف القائم على النوع الاجتماعي. ووفقاً لتجربتنا نعتقد أنه يجب زيادة النقد وإدراجه في معظم برامج إدارة الحالات العنف القائم على النوع الاجتماعي لتعزيز فعاليتها وتأثيرها الإيجابي على حياة الناجيات. شكراً لكم.
Thank you so much, Ryan. And indeed, Lebanon and Jordan and the other countries on the line today, Colombia and the Philippines, really have been flagship cases for for UNFPA in piloting and in spreading this approach. So it is really important to hear directly from case management supervisors who are representing the voices of women today. Thank you so much, Rayan. My next question is for Shiraz Al-Nsour, Case Management Supervisor with the Institute for Family Health, UNFPA partner in Jordan. Shiraz, can you tell us about the situation for refugee women in Jordan and how the cash assistance has been integrated into your comprehensive GBV case management? Thank you.
يعطيكم العافية جميعا. مساء الخير. أنا اسمي شيراز نسور، مشرف فني في مؤسسة نور الحسين، معهد العناية بصحة الأسرة بتمويل من ال UNFPA. رح أحكي شوي. إحنا في معهد العناية بصحة الأسرة متى بلشنا في برنامج المساعدات المالية. هلا إحنا في مؤسسة نور الحسين معهد العناية بصحة الأسرة بلشنا في المساعدات المالية بعام 2021 حتى ندعم السيدات والفتيات الناجيات من العنف من كافة الجنسيات وبرضه من أبناء المجتمع المحلي. بتوصل السيدات والفتيات لعنا لأنهم بيكونوا تعرضوا للاعتداء الجسدي أو للاعتداء الجنسي أو للعنف الجنسي بشكل عام أو للعنف الجنسي في مكان العمل أو العنف من الشريك الحميم. هلأ برنامجنا بيشتغل على تقديم خدمات شاملة ومتكاملة مثل خدمات إدارة الحالة، خدمات الدعم النفسي والاجتماعي، وخدمات المساعدات المالية لحتى نضمن إنه إدارة حالات العنف حتى نقيم إيش هي احتياجات الناجيات للمساعدات المالية، وبناء على التقييم بنقدم الدعم ضمن نوعين من المساعدات المالية. أول إشي في عنا المساعدات المالية الطارئة، وهي بتنعطى لمرة واحدة وبتكون خلال 3 أيام من تقييم المستفيدة. وفي عنا كمان المساعدات المالية المتكررة اللي هي بتنعطى من 3 ل6 شهور، وبتكون بنقدمها خلال أول أسبوع من تقييم الناجيات وما بيكونوا بخطر ممكن إنه بيهدد أمنهم وسلامتهم أو حياتهم، وممكن إنها تمد فترة يعني استلام المساعدة لأسبوع. هلأ أنا بحب كمان إني أشارككم اليوم بقصص نجاح لسيدات وفتيات شاركناهم وقدمنا لهم المساعدات المالية، وبحب أشارككم بالأثر الإيجابي لهاي المساعدات المالية. ففي عندي القصة الأولى هي لاجئة سورية كان عمرها 36 سنة، كانت بتتعرض للعنف النفسي والجسدي من قبل الزوج وبشكل متكرر وبشكل دائم. طبعا الزوج نتيجة للضرب والأذى اللي كان دائما يصير عليها طردها برا البيت هي وأطفالها، عندها 5 أطفال. طبعا طردها وصلت خلينا نحكي صفت بالشارع، ما في إلها أي معين، ما في إلها أي حدا إنه هو يساعدها، وما في إلها أي أقارب في الأردن. طبعا توجهت هي بهذا الوقت للجيران كملجأ لأنهم يساعدوها لحين الوصول إلى جهة إنها هي تساعدها وتأمن لها المسكن إلها ولأطفالها. طبعا توجهت السيدة والناجية مباشرة لمركزنا في مادبة حتى إنها تتلقى الخدمات الطبية، وتم تحويلها لبرنامج إدارة الحالة. ولأنه أصلا المساعدات المالية هي أصلا ضمن إدارة الحالة، تم تقييم احتياجات الناجية وتبين من خلال تقييم الكيس مانجر إنها هي بحاجة لمساعدة مالية حتى تتخلص من العنف والأذى والخطر اللي هو عليها الواقع عليها. طبعا تم تزويدها لهاي الناجية بمساعدة مالية لمدة 6 شهور، طبعا حتى تعيد ترتيب حياتها، حتى تعيد ترتيب السكن، لأنه صفت خلينا نحكي بدون أي مأوى.
think we seem to be having a small technical issue. We'll just give another minute to get Shiraz back on the line. Okay, I think she's having some issues on her end. So I think we maybe.
Yeah,
we
I think
can...
you should move on to the next speaker. She's frozen.
Okay, thank you so much. So thank you to Shiraz for telling us about how cash can make a difference within GBV case management in terms of helping with access to psychological and social services, and for describing really this experience for women and the additional impact that cash can have within case management. So our next panelist will go to Shannon Ducey from the Johns Hopkins University Center for Humanitarian Health, who has advised a number of UNFPA country offices on research, looking at whether and how cash makes a real difference in our GBV and sexual and reproductive health programming. So welcome, Shannon. Can you please tell us what you found in analyzing the data that was collected anonymously, of course, in Jordan, comparing two groups of women enrolled in GBV case management with UNFPA's partner? Over to you. Thank you.
Thanks very much, Joanna. It's wonderful to join such a great group of presenters today and discuss such an important issue. I did have some slides that I think will be shared shortly, but I'll just go ahead. Thank you. And really begin just to summarize briefly the experience that we had in Jordan, mostly because I think it really adds a lot of value to some of the experiences that we've been hearing about individual women in case management. I think this study really shows in numbers how cash really has an added value. Next slide, please. So the study that we did looked at 3 different groups that were receiving case management from a UNFPA implementing partner. And this study was done last year throughout the course of the year. And I do really want to emphasize that we leveraged ongoing UNFPA programming to do the study. And so all UNFPA implementing partners do provide case management. There was enough funding for a pilot program in certain provinces or governorates in Jordan. So the pilot was done in Amman, Karak, and Madaba. And there were 2 different groups that we looked at and for cash transfers. One received a single cash transfer valued at $100 or $150. The other group had recurrent cash transfers that were valued at $225 to $265, and that was over a period of 3 to 6 months. So all of the groups received case management as the standard of care, and then cash was added. Next slide, please. So here you can see the different governance where the pilots were implemented. And we were really interested in understanding how GBV survivors used and benefited from cash. And in particular, we were focusing on risk mitigation and also psychological well-being as our indicators. And then we also collected some information on decision-making and safety. Safety being particularly important because while there is a really strong evidence base that suggests that cash transfers are safe and do not increase risk, we really wanted to make sure that we understood this within the Jordanian context. And I should also mention, so this was a partnership between Johns Hopkins plus UNFPA and then their local implementing partner, Institute of Family Health from the Noor Al-Sain Foundation. And they were really instrumental in not only delivering the case management in cash, but also in supporting the data collection. Next slide, please. So what were some of our key results? Well, we found, first of all, that in the final interview that was done after cash assistance was received, that 90% of women that received the recurrent cash and 60% of women who received the single emergency cash transfers reported that they had improved relationships within their households. So this was obviously really exciting because it showed that, really, it seems cash did not increase risk of conflict. And we dove a little bit deeper into this to analyze just among partnered women, what this finding was. And among partnered women, all of the recurrent cash assistance recipients and 65% of the emergency 1 month cash recipients also reported that they had better relationships. So again, this is a really positive finding. Next slide, please. The study also had a qualitative component where we sought to understand in a little more depth how cash had influenced relationships. And so we saw that the findings from women that participated in the more in-depth interviews were very much aligned with what we saw in our quantitative. And they really described how cash reduced financial stress within the household, and that financial stress was very often the underlying source of conflict and violence within the households. So I think there's a really strong kind of clear conceptual pathway that came out for how cash worked. They also really discussed how important it was for women to have less financial dependence and how cash really enabled them to act a little bit more independently within their relationship and to manage money in a way that helped to meet household needs. And this also sort of strengthened their confidence and really, I would say, situation within the household to manage tensions with their husband. They were more able to say no to demands and to respond in better ways to threats that were made by their partners. So really women in both groups, I think, were very articulate in how cash was important in improving kind of not only the household financial situation, but also relationships. And one of the additional kind of key areas that came out for women that were trying to separate was that cash enabled them to afford rent so that they could separate from their husbands, or they were able to use the assistance to file, for example, legal paperwork. So I think there's also potentially a really strong long-term benefit in some cases for cash when you think about kind of these longer-term protection outcomes and women really being able to have choice in their own safety and well-being. And also I think to help with protection of their children as well. Next slide, please. The other outcome that I mentioned that we were interested in looking at was psychological well-being. And here we saw that when we did our baseline survey prior to receipt of cash, that only around 3 to 6% of women in each group reported they had no feelings of depression or hopelessness over in the month before the survey. And so we asked the same question at follow-up. And at the first follow-up, we found that just under a quarter of the single cash recipients and almost a third of the recurrent cash recipients reported they had no feelings of depression. So a sizable increase. And this compared to only 4% in the control group. So in our control group, women's psychological well-being stayed relatively stable, whereas we saw an improvement in both the cash recipient groups. And at the second follow-up, we saw still an improvement. And over time, we saw that the feelings of depression and hopelessness increased by 1.5% in the control group. And we saw, decreases in the emergency cash and the recurrent assistance group that were much larger. Next slide, please. And so, I should note too that that finding was statistically significant. And so we felt very confident overall that the cash assistance not only improved risk mitigation, but also psychological well-being. And when we dove a little bit deeper into the psychological well-being in the qualitative work, we found that women really were able to describe how cash reduced their stress and disagreements, which is, I think very aligned with the findings that we saw in terms of household relationships. And they really did describe how they felt more strength and self-confidence and ability to be successful within their roles. And I should also mention that another theme that came out very strongly in our qualitative interviews was the importance of case management and really the strong support that women received from their case managers and how beneficial this was, not only in terms of referrals, but in terms of counseling, creating safety plans, And really, I think having a very holistic approach to support of survivors. And so I think it is really important to highlight that while cash is an excellent tool, and it should absolutely be integrated into case management, and I think it has very strong benefits within the case management context, for GBV survivors and protection programming, cash alone is not sufficient. We really still need that strong case management focus, and cash definitely can have added value to that, but it's not a replacement. Next slide, please. So with that, just to offer a few kind of summary recommendations and our conclusions, we found that, cash assistance was really effective within the context of case management for reducing GBV risk and violence within the household, and also improving psychological well-being. And these were really exciting findings to have that were expressed, I think, quantitatively, because very often we see a lot of qualitative and anecdotal studies, but I think that this study is really powerful in putting some numbers behind the evidence. And I think another thing that came out very clearly was that recurrent cash transfers had larger benefits, and they were also preferred by beneficiaries. And so I think the largest takeaway that we came away with was that when funding permits, recurrent cash for survivors is a really important tool to improve outcomes. And understanding the difficulties of funding right now and the immense humanitarian needs globally, I do think it is really important that this group be prioritized, because they are among the most vulnerable of vulnerable populations. And sometimes I think a small amount of cash, when it's provided in conjunction with other services in case management, really can be a very powerful tool in changing trajectories of these women's lives, and really enabling them to take actions that they think will improve their well-being. So with that, I'm going to hand it back over to Joanna, but thank you very much to our colleagues in Jordan for the excellent work, and everyone for joining today to spend time discussing such an important topic.
Thank you so much, Shannon, and thank you for mentioning the importance of numbers, that we're adding some quantitative information to the qualitative and anecdotal information that we get from women directly through case managers, through implementing partners. And I think it's important also, I saw that there were a few questions in the Q&A, that today we are talking about cash and voucher cash assistance within GBV case management. So this is not something that we distribute or that we target through a kind of algorithm, but it's really important to look back and say, how is integrating it within GBV case management? How does this complement case management? So I think the research has driven that point home, that we're really seeing the difference that cash within GBV case management can make. We're starting with our strong GBV case management programming, and we're complementing it with cash. And so I'd like to go back, in fact, to Shiraz, who was speaking about the experiences in Jordan, to finish giving that kind of learning from the field. And then we also have a small video from Jordan that will help to drive home the points that we're making today. So let's see if we can get Shiraz back on the line. Okay, there seems to be maybe still an issue with the video. I know that. Okay, go ahead, Shiraz. We see you.
أنا بعتذر على انفصال النت يعني، بس أنا هلا رح أستكمل معاكم القصة الأولى للناجية السيدة السورية اللي يعني نتيجة للعنف وللأذى وللضرر اللي كان يمارسه زوجها عليها وصفت لحالها في البيت. أنا وصلت لحتى إني أنا أحكي لكم إنها هاي السيدة بقدرتها وبقوتها من خلال المساعدة المالية وبرنامج المساعدة المالية استطاع إنه هو ينقذ حياتها وينقذ حياة أطفالها. فقدرت من خلال المساعدة المالية وبعد تقييم الكيس مانجر لها ولاحتياجها تم تقديم مساعدة مالية لمدة 6 شهور. استطاعت من خلالها إنها هي في البداية إنها تشتري خيمة وتنفصل هي وأطفالها في هاي الخيمة وتبعد تماما عن مصدر الخطر والضرر اللي كان من زوجها، وانفصلت بشكل تام عنه. وطبعا نتيجة لخطة الاستجابة الشاملة والمتكاملة والماكنة خلينا نحكي، قدرت إنها هي تبلش في مشروع بيتي صغير، وكانت قادرة إنها تعمل منتجات غذائية وتبيع لحتى تبلش من أول وجديد، ولحتى إنها يعني خلينا نحكي تعتمد على حالها. طبعا بلشت هي تجني، خلينا نحكي حصاد تعبها وتشتغل بشكل جيد، وانتقلت من الخيمة لبيت مستقل لإلها. وطبعا هلأ هاي السيدة هي مثال وقدوة بتقوم بمشاركتنا ومشاركة السيدات الأخريات والفتيات كيف إنهم هم يبلشوا في مشروعهم بشكل خلينا نحكي مستقل، حتى إنها هي ترجع تمسك زمام أمور حياتها بإيدها، وهي كانت قادرة إنها هي تغير وإنها ما تعتمد على حدا، تطلع من دائرة الاعتمادية وتكون إنسانة قوية معتمدة على حالها. رح أشارككم برضو بقصة تانية وأثر تاني للمساعدة المالية. أنا في عندي ناجية تانية كانت برضو هي لاجئة سورية، كانت بتتعرض للاغتصاب من قبل الأب، بالإضافة لكافة أشكال العنف، من عنف نفسي وجسدي من قبل الأب، وطبعا لأكثر من مرة. ما قدرت في البداية إنها تبلغ لأنه يعني حتكون وحيدة، وحتكون هي طبعا بتربي ابنها، فبالتالي ما في أي مكان تاني يقويها هي وابنها. وكمان خافت من نظرة الناس، نظرة المجتمع لإلها، خافت إنه ما حدا يصدقها. طبعا هذا بنتيجة لهذا الوضع خلاها في مكان آمن غير آمن وخطر، لأنها في نفس البيت مع المعتدي اللي هو أبوها. طبعا نتيجة لخوفها من إنه هي يصير في عندها حمل غير مرغوب فيه، نتيجة لأنه زاد الأذى وزاد العنف عليها، فهي قررت هون إنها هي تبلغ عن حادثة العنف والأذى اللي هي بتتعرض لإلها. فلجأت فوراً بشكل مباشر لمركزنا اللي في الكرك، وكانت بدها تحصل على الدعم النفسي والاجتماعي. طبعاً هي تلقت عدة خدمات في وجودها في مركزنا في الكرك، فأخذت خدمة العلاج السريري للناجيات من الاعتداء الجنسي، للناجيات من الاغتصاب. طبعا هذا على الرغم من هي إنها وصلتنا بعد مرور شهر على الحادثة. تم تقديم طبعا خدمات الحماية، وتم تحويلها لإدارة حماية الأسرة، وتم تقديم خدمات الدعم النفسي الشاملة والمتكاملة حتى تكون أكثر مرتاحة وأكثر اتزان وأكثر استقرار. وتمت متابعتها وتم تزويدها بمساعدة مالية متكررة لمدة 6 مرات، حتى إنها تترك منزل والدها اللي هو المنزل المعتدي، والحصول على مكان أكثر أمان وأكثر هدوء إلها ولابنها. وفعليا المساعدات المالية وخطط الاستجابة كانت قادرة إنها توصل السيدات لمكان آمن وتخلص من الأذى والعنف اللي واقع عليها. فأنا بشكركم ويعطيكم ألف عافية.
Thank you so much, Shiraz, and thank you very much for explaining how cash can really be a valuable tool to help GBV survivors to flee or escape from abusive situations. And these are very, very individualized kinds of services. I think that's really the point that we want to drive home today, so that women can access specialized services, social support, and psychological support. Now we'll go to a short video from Jordan, which will also describe the situation there. Thank you.
كنت دايما أحس إني بدون قيمة، ثقتي بنفسي كتير قليلة. هلأ بقدر أتحمل تكاليف أدويتي، أجيب أغراض للبيت، أشتري أواعي الشتاء. الحمد لله إجت المساعدة بالوقت المناسب، سددت ديوني واشتريت كاز أدفي الولاد وعملت جراحة لعيوني.
بلشت بإجراءات المحكمة وقدرت أتخلص من العنف اللي كنت بتعرض له من زوجي. هلأ أنا عم بعيش مع أهلي وعم بتابع إجراءات الطلاق. إجت المساعدة بالوقت اللي أنا بحتاجه.
كتير استفدت من المساعدة النقدية وكتير عززت بشخصيتي، وهسا بقدر أحكي لأ بكل قوة. سديت ديوني وغطيت التكاليف الطبية اللي علي، وغير هيك الدعم النفسي اللي أخذته خلاني كتير أقوى من قبل.
أنا قدرت إني أبعد حالي عن جوزي اللي كان يمارس علي العنف، وهلأ عم بعيش مع أولادي بفضل المساعدة النقدية، ما عدت بحاجة لإله.
أنا كنت بشتري من صاحب الدكان بالدين، كان يستغلني ويضايقني. لما استلمت المساعدة النقدية قدرت أوقفه. كل الستات اللي زيي ما عندهم دخل أو دعم بحاجة فعلية لمثل هيك مساعدات حتى ما يتعرضوا للاستغلال.
Thank you. So another very important description of the situation for women in Jordan. And I really want to say that thank you to all of the caseworkers and colleagues who have been attesting to the impact that cash can have for imminent needs, for mitigating further risks, and also in contributing to economic stability. So clearly the linkages here to other development partners is also crucial, as a number of our speakers mentioned the role of women's economic independence in contributing to their ongoing safety. So after they flee a difficult situation, a violent situation. And we know that cash and GBV case management is making a difference. We have women's voices and also research that shows between comparison groups that this is the case. So thank you to our speakers for this. I want to also say, following these voices from the country offices, that UNFPA is developing global guidance on our approach that will be shared next year, so that other local partners, governments, NGOs, and UN agencies, and all those represented today in the audience can have access to that, and that will be available as part of comprehensive GBV case management. So we'll continue to lead in this area and ensure that the cash that UNFPA is applying is high quality and not just high numbers, and that we're making women's voices count as they have today. So I would now like to turn over to Ms. Janine Nguyen, and welcome Ms. Janine Nguyen, Deputy Assistant Secretary of the United States Bureau of Population, Refugees, and Migration. Thank you so much for joining us, and over to you.
Thank you, Joanna, and to all the panelists for sharing your expertise on this really important topic of leveraging cash and voucher assistance in gender-based violence programming. And I want to thank UNFPA for your strong leadership on preventing and responding to gender-based violence in emergency situations. It is so critical, and we're grateful to you. This event has been a great way to learn about the transformative power and the potential of using CVA as a tool in gender-based violence, case management, and crisis settings. We've learned CVA can be an effective way to prevent and respond to gender-based violence, specifically when delivered within case management and alongside strong protection interventions. The caseworkers and coordinators who spoke today clearly showed how the individualized nature of this support is changing the lives of women and girls. And we saw that from the video just a few minutes ago from Aman. The research they shared illustrates how this type of support addresses the unique needs of women and girls, including how integrating that cash assistance into case management actually supports and strengthens women's agency, and how it can have a positive psychosocial impact. We also know that CVA alone cannot address all protection needs or guarantee access to things like local education or social support systems. But our shared challenge is, how can we better support humanitarians to consider individual and local contexts and preferences to most effectively weave CVA into our gender-based violence programming. In the past several years, the humanitarian community has made immense strides through research and evaluations on CVA and gender-based violence programming. For example, we learned from a recent UNFPA and Johns Hopkins evaluation in Jordan that the addition of CVA to case management for survivors and women at risk of gender-based violence yielded additional benefits by mitigating the risk of violence, improving psychological well-being. Moreover, the research demonstrated that recurrent cash transfers yielded greater benefits in terms of improved partner and household relationships and psychological well-being. These results highlight, this data highlights the progress we've made on building a greater evidence base for how to use CVA to improve gender-based violence programming outcomes. This is a huge success of the past few years, as well as an area where we need to continue building on moving forward. Like any other modality for delivering assistance, the right program design, appropriate program design, and the targeting of CVA is going to be really key or foundational to its effectiveness. I think an important next step is to continue breaking down the silos between protection actors and those working on CVA. We need to start using the evidence base that's been generated to further even greater synergy across both our protection and our cash assistance counterparts, so that we're integrating this modality into gender-based violence programming across the board, turning the research that's been done into daily practice. Finally, today's discussion showed that using CVA and gender-based violence case management demonstrates how the humanitarian community can indeed put women and girls at the center of a response in a way that prioritizes the diverse needs that they have, and in a way that empowers them to take control of their own lives, their own health, and their own safety. This enhances women's agency, putting decision-making power directly into the hands of those most affected by the humanitarian crisis. This type of support is a positive, concrete example of what we are trying to accomplish through Safe from the Start Revisioned, the United States initiative on preventing and responding to gender-based violence in emergencies. My boss, Assistant Secretary Julieta Noyes, has said that through this initiative, we're shifting power to crisis-effective women and girls by elevating their expertise, bringing it into the conversation, welcoming their contributions to survivor-led service provision, and embracing their leadership. Women in crisis-affected communities bring their valuable lived experience to crises, often serving as first responders. The humanitarian response architecture needs to recognize that beyond the aid recipient frame, these women are truly experts, service providers, and leaders. So the United States is committed to strengthening women's leadership and in prioritizing our support for gender-based violence prevention and response, and shifting funding and decision-making power to women and girls. So we look forward to continuing this conversation with UNFPA and all of you, and we look forward to our continued partnership so that we can make this vision a reality, and as I said, turn our research and evidence into daily practice. Thank you.
Thank you so much, Deputy Assistant Secretary Nguyen, for your reflections on today's panel and on today's discussion. And thank you also for really highlighting the role of our local partners who we heard from today, the women frontline responders and first phase responders who are really the frontline with women. So on behalf of UNFPA, please let us extend our thanks to the United States Bureau of Population, Refugees, and Migration and the Swiss Agency for Development and Cooperation for jointly hosting and delivering this event with us. We heard from country offices, from local partners today, from donors, member state partners, and researchers. And we want to thank everyone for joining us and sharing their insights and experiences to give a holistic picture of this approach. And I think one of the key takeaways is that cash assistance, if it's done right, as Deputy Assistant Secretary Nguyen was saying, if it's done right within the process of comprehensive GBV case management, can really provide a huge boost to women. We've seen from case managers and from our various speakers today that cash assistance can also be more flexible. It can be more cost effective than other kinds of assistance. And this has been documented, but we also want to drive home the point that aside from the large scale cash assistance that we often see in emergencies, a small amount of cash within strong gender-based violence response programs can really change a woman's life. So with your support and cooperation, UNFPA, which is the Sexual and Reproductive Health Agency of the UN, remains committed to the right to bodily autonomy and for freedom from violence, including working towards our transformative result of zero gender-based violence by 2030. And we believe that these rights can't be measured in numbers, but rather in women's own assessments of their dignity and their choices. And we've really heard that today. So thank you to everyone for joining us. Thank you to our speakers and our donors, and we look forward to continuing this conversation. Thank you.